Hey everybody, and welcome to the Dr. Mom Show. It's Dr. D, mom of three. Thank you again for joining me today. As you can see, it's a little bit casual today, and I'll let you know why. Today is something very special out there in the United States, and I'm going to tell you about that in a bit. But yes, it's Dr. D, mom of three. Love this shirt. It was a gift, so super excited about that. So before we delve into it, don't forget that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So definitely, if you need medical advice, seek out your physician or your child's physician. This is for educational purposes, so you can have a better conversation when you go to the doctor's office. Also, don't forget to check me out at www.dalenemushalak.com. There you can see all the fun things I have going on. I'm super excited because my virtual book launch for Women of War, Peace in the Midst of the Storm is coming up right on Facebook Live June 6th at 10:30 a.m. Eastern Standard Time. It is waffles and Women of War. You don't want to miss it. Bring your breakfast, bring your waffles, any type of waffles. My personal favorite, chocolate chip waffles, but you can bring chicken and waffles or whatever, plain waffles, your Eggo waffles, whatever kind of waffles you want to bring. So that should be a lot of fun. There's going to be tons of surprises and giveaways, so you definitely want to get in on the action. Also, if you check out my website, you'll be able to purchase The Tripsies and Me, my international bestseller. And then also Mom, M-O-M, Meditate, Overcome, Motivate. That I only have a limited supply left, but just so you're aware, both Mom and The Tripsy and Me are available on Amazon in an ebook, so those are available. Also, just so you know, I worked on a recent book collaboration with my sister. It's a devotional called This Is How I Fight My Battles. So right now there is a special bundle going on where you can get both of those books. Normally it's $38 for both books, but there is a limited time offer for $30 for both books, which is a steal. And that includes shipping, so that's pretty awesome. So I know somebody out there knows some woman in their life, whether it's your wife, grandma, mother, aunt, whoever it may be, that you can get both of those books for. Save it for Christmas. You know, Christmas always sneaks up on us. Save it for the next Mother's Day and for their birthday. So, well, I hope everybody's hanging in there. I know most of those states now are kind of loosening up their stay-at-home policies. So again, everybody stay safe, continue to do your social distancing and good hand hygiene. Also, most places you aren't able to go to without a mask, so definitely make sure you have your mask. So today is special, and the reason I'm wearing purple because March 26th is Purple Day, and it is a day that we recognize as Epilepsy or Seizure Disorder Awareness Day. And it's amazing, if you just Google Purple Day, you'll see that it was a young lady who started Purple Day who has a history of epilepsy, and she wanted the world to know more about epilepsy because it affects a lot of people in the world. So she just wanted to educate people. So I definitely give kudos to her because she's young, and she went out and did something to teach the world about her disorder, so people around the world could know more about it if they have a loved one, or even if they themselves suffer from epilepsy. So we'll go right into it. So epilepsy itself is a seizure disorder. In order to be diagnosed with epilepsy, usually you have to have at least 2 unprovoked epileptic episodes. So pretty much if you have one seizure and it's an isolated event, you probably won't be called an epileptic, or it won't be called an epilepsy disorder. It has to be at least 2. And again, usually unprovoked. So provoked seizures can occur with different things, such as a stroke. Sometimes we see people who've had some sort of brain injury. So we see athletes can have traumatic brain injuries with concussions. Also, if somebody's been in a motor vehicle accident, that can cause an unprovoked seizure. An infection such as meningitis or encephalitis, that's when the fluid in our brain gets infected. That can be from a mosquito bite, a virus, bacteria. So there's different things that can cause that infection, and again, that can induce a seizure. And then the other thing is drug or alcohol withdrawal. Yes, you can have seizures when you withdraw. So in reality, you shouldn't be using drugs or alcohol, so just stick with that and you won't have to worry about any provoked seizures. And then on the flip side, we have unprovoked seizures. So something pretty much happens to the neurological symptoms. So sometimes we see unprovoked seizures in dementia, such as Alzheimer's disease. And then, of course, cancer, we can see unprovoked seizures because if somebody has a tumor in their head, or if somebody has cancer someplace else, but it what we call metastasized or spreads, that can induce seizures. So that's what we call unprovoked. So how do people usually present? So there's a myriad of presentations that can happen because there are different types of seizures. Usually seizures that we see more so in kids, and that's when it's diagnosed, is called absent seizures. And in those seizures, kids can have staring episodes where they're like almost daydreaming, and if you're talking to them, they don't look at you and they don't acknowledge you. A way you can differentiate is if you call their name. You know, if somebody's daydreaming and you call their name, usually they'll come to you, or if you snap your fingers, they'll come to you. Whereas with absent seizures, usually they just stare off, and then even if you're calling their name, they're not coming to you, and that's because they're having this absent seizure. And then you can have a focal seizure. Focal seizure is where the seizure affects one part of the body. So it could be just the left side of the body that gets affected. And then generalized seizure is where kind of that full body shaking, or what we call grand mal seizures. Those are pretty intense when you see them, and those are the ones that usually on television and stuff we see. So again, there's different ways that this can prevent. So again, people can have shaking, they can have jerking, where it's like full body convulsing, or like one side. Also, patients can have episodes, again, we talked about the staring episodes, kind of off into space, but won't come back even if you're snapping or calling their name. Also, they can have like numbness or tingling, almost like a shooting neurological sensation in their neurological system that they feel. And they're just like, oh, I'm feeling this like weird sensation either in one part of my body or my whole body, like from my brain shooting down to my feet, almost like an electric shock that they have. With numbness, tingling, also they can have some weakness. Sometimes people can't even talk, so they're not able to talk while they're having a seizure. So again, you can see it's the neurological system that's affected. So like movement, the numbness and tingling, the speaking. Of course, everybody knows like with the tongue and airway that sometimes patients, because they're convulsing so much, their tongue can come out, and they can also bite their tongue. So, so these are some ways that it can present. Another thing is just to be mindful of with kids, sometimes there can be an underlying genetic disorder that causes the seizures. So that's something very important, that if, let's say, your child is diagnosed with a genetic disorder, you want to make sure that seizures aren't necessarily associated with it, or if they are, that you're always mindful of keeping an eye on your children if they are diagnosed with a genetic disorder that's associated with seizures. So, you know, some things that can trigger seizures, and now I see it on the warnings, like the ratings of movies, it'll say, oh, you know, rated PG-13, but, you know, photosensitivity, be warning that, you know, there's flashing lights. So some things that can trigger seizures, not like, oh, you'll have seizures if you do this, but what we call lower your threshold for seizures, or can induce the seizures if you have a seizure disorder, is if there are flashing bright lights, so like strobe lights, or if you go dancing, those disco lights, of course sometimes even video games, because sometimes things are flashing all over the place. And then lack of sleep. So if your body is tired, that definitely lowers the threshold for you having a seizure if you do have an underlying seizure disorder. So those are things that if you do have a seizure disorder, your child has a seizure disorder, you want to be careful of. Make sure they're not watching shows or around anything where there's bright flashing lights, or and they're getting a good amount of sleep and resting well, especially during this time of COVID-19, because I know a lot of people are not doing their sleep routine and going to bed late and waking up late because they don't necessarily have some place to go. Just to backtrack a little, in kids, sometimes we can see what's called febrile seizures. Just so you know, it isn't necessarily the fever that's causing the seizure per se. Really, it's how quickly that temperature rises that induces the fever, that induces the seizures. So I know a lot of people are like, oh my gosh, as soon as my child has a fever, like, I don't want them to have a fever because they're going to seize. Not necessarily. It's really just how rapidly that temperature changes that can cause them to have a febrile seizure. So let's say someone presents to the doctor and you feel like you're having episodes or something weird's going on that's not usual for you. How do we diagnose seizures or epilepsy? So again, the mainstay is history taking, so a detailed history. So if you've had a witnessed event, that is perfect, because somebody that you know can explain what has happened. Now, we talked about focal seizures, so just so you know, with focal seizures, sometimes people are aware of what's happening and sometimes people aren't aware of what's happening. Usually with grand mal seizures or generalized seizures, people are not aware of what's happening. And before seizures happen, some people can have what we call an aura, or almost like a either pre-smell or pre-feeling to the seizure that is like, oh my goodness, it's going to happen. So whether it's like numbness, tingling, whether you smell something funny, whether it is vision changes, they can have this aura. So that's why history is very important, because what is described will help the physician kind of be like, yeah, that really sounds like a seizure. Let's do further testing. Of course, tests that are included are called the EEG. Pretty much they put little stickies, if you've ever had an EKG on your heart, the same little stickies like that, they put it on your head and pretty much look at the brain waves, and there's different patterns that coincide with the different types of seizures. So for example, with absence seizures, we see a certain type of pattern. Now, a lot of times we have people who have an episode and then we don't necessarily see anything on EEG, and sometimes a neurologist will order an EEG that's like a 24-hour EEG just to monitor a little longer. The other thing a neurologist may get is an MRI, because again, they want to see, is there any trauma to the brain? We talked about potential of dementia, metastasis of cancer. So if there's any other underlying reason, you may also get labs, because low sugar, so hypoglycemia, can cause seizures, imbalance of your electrolytes, so sodium, calcium can potentially cause seizures. So there are a lot of things that can induce seizures. Again, that may not necessarily be defined as epilepsy, but there's different reasons why somebody could have seizures. And of course, we talked about alcohol or drug withdrawal, that we can see that. So when they're asking your social history, if you do anything, like that, definitely let them know. And we talked about infection earlier. So one of the tests they could do is what's called a lumbar puncture, or a LP, which they tap the spinal fluid. And again, that helps to let us know if there's an infection, whether viral or bacterial. So those are some things that can be done. And also a physical exam is important. So treatment, if you are diagnosed, again, you should be referred to a neurologist. You should be seeing a specialist. If you have a history of seizures or epilepsy, you should see a neurologist who is a specialized physician in seizures. And normally you are started on medication, and sometimes you're given what we call like an emergency medicine also, that if you go into a seizure and the seizure is not stopping after a set time, that you go ahead and take the emergency medicine. So it is important to definitely see a specialist. And a couple of things, precautions: if you do have seizures, please be aware that you should not be driving. You should be cleared by your neurologist in order to drive. So pretty much you have to be seizure free for a specific amount of time, and that decision should be made by your neurologist because they know exactly how you've been doing, when your last seizure was, how you're tolerating the medicine, and all those things. So again, happy Purple Day with Dr. D, mom of 3. I hope this has been helpful. If you have any topics that you want me to talk about, definitely let me know. Hit me up on drmomshow@gmail.com. You can also get on there at DaleneMushalak.com. If you have any comments, leave those comments below the video. And if you have any topics, you can always comment on that. And don't forget to stay safe during this time. And don't forget to wash your hands, kiss your kids, love your family, and say your prayers good night. Love you guys. Bye-bye.